The fourth step is mobilize and monitor. Its purpose is to implement our campaign and ensure that it's being delivered effectively with the flexibility to adapt. So this is where our strategy goes live. We roll out our campaign activities and distribute our materials across the chosen channels. But just launching isn't enough. We must also monitor the real-time progress. So in monitoring, we ask, are we reaching our intended audience? Are the materials being distributed and used properly? Are the activities being conducted on schedule? Are there barriers or issues emerging that we didn't anticipate? And this will require tools in order to monitor and measure it. Let's say we use attendance sheets, we have social media metrics, we have field reports, partner feedback, and even spot checks and field visits. So monitoring allows for mid-course correction. If one channel isn't working, for example, you post in Facebook, which is it's not reaching the people because of low internet areas. So you can now try to shift gears and invest more in radio or in-person events. Another example we could give is, let's say, a campaign monitoring voluntarily for blood donation partnered with schools and barangays. However, when you are monitoring, it revealed that working adults couldn't attend the daytime sessions. So, what can we do? The team can adjust by offering after-work donation drives in malls. So this will allow more participants to be involved in our activity or in our campaign. Lastly is step 5. We have evaluate and evolve. Its purpose is to determine whether our campaign met its objectives and, if possible, to improve future programs using the data and lessons we've learned. So this is the final, but somehow the ongoing phase. Evaluation is not just about the numbers, but about the meaning and its impact. So what should we look at? We need to look at the process indicators. Did the activities happen as planned? The outcome indicators. Did the people change their behavior or their attitudes? And the impact indicators. Did the intervention affect long-term health, social, or economic outcomes? So you need to gather both quantitative and qualitative data. Importantly, after gathering this data, you need to share the result with the stakeholders. So it's either from the community leaders to the donors to your internal team. Then you take what you've learned and feed it back into future campaigns. This is the evolve part. Advocacy is never static. It adapts with time, with context, and the needs of the audience. So running through all 5 steps are 3 essential concepts: the use of theory, stakeholder participation, and capacity strengthening. On the first one, the use of theory, we rely on the communication and behavior change theories. For example, we have the theory of planned behavior or the social cognitive theory. This will help us to understand what drives people's actions. The second one is stakeholder participation. So advocacy isn't a one-person show. We need to involve the community members, the government, health workers, and more, because their insights make our messages more relevant. Lastly is capacity strengthening. We build the skills of individuals and institutions so that they can sustain communication efforts even after the campaign ends. So it's like building not just a house, but training the people to maintain and improve it long, even though the builders already left. So the P process has been used in many contexts worldwide. So in family planning, when we wanted to reduce teenage pregnancy, in HIV and AIDS campaign, where we want to reduce the stigma and encourage testing, in maternal and child health, wherein we want to promote safe childbirth practices. And we also have environmental advocacy, like promoting tree planting or zero waste program. Actually, here in the Philippines, imagine using the P process for anti-plastic campaigns, voter education, or disaster preparedness. It's adaptable. Whether you work in schools, LGOs, or NGOs, it doesn't matter even if you have a small budget or a national program. The P process can scale up or down. So, when we think of communication strategies, we often imagine a checklist: conduct research, make posters, launch a Facebook page, evaluate results. But the P process is more than just a series of tasks. It's a philosophy and a practice. It shifts the way we think about advocacy from something linear and technical to something collaborative, adaptive, and transformational. So let me try to break this down into three key ideas that makes the P process more than just a tool. One, it fosters true collaboration. In traditional project models, planners and decision makers often operate in silos, designing interventions for communities without fully engaging them. The P process insists that we co-create with the people we want to reach. It tells us, stop talking at people, start listening to them. Stakeholder participation is not a checkbox, it's an ongoing commitment. This means that involving barangay officials, youth groups, health workers, teachers, mothers, even tricycle drivers, depending on the issue. These are the people who will carry the campaign forward and give it legitimacy. Another thing is it encourages responsiveness and flexibility. The P process isn't rigid. It encourages you to go back to earlier steps when necessary. If the monitoring shows that your materials aren't reaching your audience, you need to revisit step 3 and revise them. If your goals change based on a new health data, then you revisit step 2 and redesign your strategy. And that's the difference between static planning and strategic thinking. Lastly, it builds sustainable impact, not just temporary awareness. So let's try to be honest. Some campaigns only create short-term buzz. People watch, like, share, and then forget. But with the P process, we aim for lasting change. And lasting change requires more than just content. It requires capacity building. This means empowering local champions, strengthening institutions, and making sure that people understand why change is needed and not just what to do. So when we say the P process is not just a planning tool, we are saying that advocacy isn't just about delivering a message. It's about nurturing change. It's about changing mindsets, building trust, and investing in people, not just on the projects. So whenever you use this framework, remember, you're not just launching a campaign, you're sparking a movement. So before we end our discussion, I would like to leave these two questions. One, which step in the process do you think is most often skipped or rushed in real life advocacy campaigns? And why do you think that happens and what could be the consequences? The second would be, how can we ensure that meaningful participation happens at every step of the P process and not just as a one-time consultation? So that brings us to the end of our discussion. Thank you for your attention, questions, and ideas. Remember, advocacy is a journey and the P process can help guide us every step of the way. Maraming salamat po and let's continue creating campaigns that uplift and empower.